Right now, I want to talk about HIV and AIDS. Now, the Ghana Health Service is pushing for the implementation of strategies needed to increase treatment and also improve care service for persons living with HIV and AIDS. Addressing a webinar to commemorate World AIDS Day today, Director General Dr. Patrick Yeboah revealed that Ghana has over 300,000 persons living with HIV/AIDS, with 20,000 annual infections and 14,000 HIV-related deaths. He says this worrying trend constitutes a major health crisis, but can be contained if stakeholders do not relax with their response approaches. The Director General of the AIDS Commission, Chairman Etuahene, noted an upscale of testing, especially among men, is ongoing. He adds that a human rights-based response and funding avenues are also being made available to address issues of social protection and access to treatment. I'm going to speak with two people, Dr. Kofi Odoelabi. He's a medical officer at WAAF, and Kwabena Otu, who is a counselor as well. Gentlemen, you're welcome and thank you very much. Help me with WAAF. Okay, so WAAF stands for West African AIDS Foundation. And it's an NGO that was set up in 1999. Okay. Basically, they provide education, advocacy, testing, outreaches of diseases, infectious diseases such as HIV, AIDS, tuberculosis, and in general, chronic diseases that affect the general public. So they work together with IHCC, International Healthcare Center, a clinic, to provide these services to the community and to the general public. Okay. Yeah. So let me start with the statistics, or if you like, the overview, the problem overview that we just put out there according to the Ghana Health Service. Okay. We are in a crisis. I don't know which of you is Dr. Odoelabi. Must be you. Okay, so this is a health crisis as the health service is describing it. Why are we here? I thought we've done a lot of work already in this area. Yeah, so yes, a lot of work has been done by the Ghana Health Service, but there is still a lot more to be done. If you look at the statistics that was mentioned this year and then contrasting it against the goal by the UNAIDS, which was to achieve the 90-90-90 target by 2020, you can see that we are still way behind and there's still a lot more work to be done. Yes. Let me bring you Mr. Otu. Are you Mr. Otu, right? Yes. You are a counselor. Yes. You counsel people who have who live with HIV? Yes. Why, when you talk to them, do you think we're still experiencing this prevalence?
Actually, what happens is, you know, the education in our country, the education level is gone down. And then even in schools and in churches, when you mention HIV, they are like, hey, this guy want to impose HIV on us. So they don't. So, we don't want to talk about it. Yes, we don't want to, as a country. Yes. We don't want to talk about it. We used to back we used to back then. Yes. Going forward, and because of time, indeed, today has been a lot of election-related activities, and I'm sure we can have this conversation another time. But going forward, what can we do to improve upon the education, if that is what we have to do to get people sensitized? Actually, what we can do now is to start the education from our schools, okay, and then to our churches. Who and will you task with that responsibility? The AIDS Commission, okay, the media, I mean who? The AIDS Commission plus the Ministry of, yes, Education, Ministry of Education, and yes, they should help with that. I don't want to come in. I'm just going to take your final words for this one, yours, and then we'll bring in Ms. Otu to end it all. Yeah. So to add to what he said, one reason why we are still having some challenges, especially has to do with the issue of stigma. Okay. A lot of people are unable to come out to disclose their status because of the myths and fears people have regarding the HIV virus. I thought we moved past that a long time ago. Surprisingly, it's still there. Okay. Still there. We have people who are partners who have been in relationships for many years, and they still find it difficult to disclose to their partners because it may end up breaking up the family, etc.
So we should look at dispelling these myths, and he rightly said education, right down from the secondary level, because at that point they are more sexually active. We let them know this is HIV. We look at even including it in their curriculum, because I remember when I was in secondary school, we used to learn about cholera, we used to learn about malaria.
So you think we should put it there?
Yes, I think we should put it there. Yes.
All right.
Yes.
We'll end it at this point here. If you have a quick one to add, we can do that. Otherwise, we can bring up this conversation another time.
Okay.
Right.
Okay. What I want to say is that HIV is real. HIV is real. Let's protect ourselves. There's PrEP today. There are condoms out there. There is ARVs. You know, there are so many ways you can protect yourself.
So the message is protect yourself.
Yeah.
Protect yourself. Just as we're protecting ourselves from COVID-19, we need to protect ourselves from HIV. It is still real and it is still there. All right. Thank you very much for coming. Kwabena Otu is the counselor, and Dr. Odoi Labi as well, there with the West Africa AIDS Foundation. And today is World AIDS Day. We wish you all the best out there. If you are living with this, take care of yourself. If you are not, protect yourself.